This slide has a visually blended background of soft out-of-focus green and yellow tones evoking a natural and serene atmosphere. At the top, there is a circular cutout of a globe with a transparent overlay symbolizing global awareness. In the middle of this slide, large white text reads National Lead Poisoning Prevention Week. Below that, in smaller text, it says Nexus Presents. To the right side, there is a large hexagonal image of children running and smiling in a park on a sunny day, surrounded by trees and green grass. Centered in bold text is the title, Lead-Free Communities Initiative, The Road to Lead Exposure Elimination. The bottom section of the slide features the CDC and ATSDR logos in blue boxes. To the right, the text announces the webinar date and time, October 24, 2024, 2 p.m. to 3 p.m. ET. In the top right corner, a small icon labeled Webinar shows a simplified illustration of a video call interface, hinting at the virtual nature of the event.
All right, good afternoon, everyone. I'm Brooke Burt, a health communications specialist in the Division of Environmental Health Science and Practice. I'd like to welcome all of you to today's Environmental Health Nexus webinar. This week is National Lead Poisoning Prevention Week, and today's Nexus webinar is Lead-Free Communities Initiative, The Road to Lead Exposure Elimination. A few quick housekeeping notes. Today's session will feature a presentation followed by a Q&A session with our panelists. Please note that all participants are in listen-only mode and closed captions are available for this webinar. Next slide, please, Renee. Thank you. Today's Nexus webinar will be available to view on demand in a few days. You can find the video recording of today's webinar at the CDC Nexus webpage at cdc.gov/EH-Nexus, or you can scan the QR code. Next slide, please. Thank you. You may submit questions at any time during today's presentation. To ask a question using Zoom, click the Q&A button at the bottom of your screen and then type your question in the Q&A box. Please keep in mind that we may get more questions than we can answer in a live session, but we will do our best. Next slide, please. Please note that the findings and conclusions in this presentation are those of the authors and don't necessarily represent the official position of CDC. Next slide, please. I'm happy to introduce our presenter for today. Quanza Brooks-Griffin is the unit lead within the Strategic Priorities and Innovation Unit of the Lead Poisoning Prevention and Surveillance Branch in the CDC's National Center for Environmental Health, Division of Environmental Health Science and Practice. Thank you to Quanza for being here with us today. And now I'll turn it over to you, Quanza.
Awesome. Thank you so much, Brooke. And thank you to everyone that has joined the webinar today. As of this morning, I heard that we had over 450 registrants, so that makes me very, very excited to share this information with all of you as we help our communities become lead-free. I also want to say Happy Lead Poisoning Prevention Week. This is an exciting time to give such a webinar as we're encouraging more community-based organizations and individuals to take action on preventing lead exposure in our communities. As Brooke mentioned, today my presentation is on the Lead-Free Communities Initiative, the Road to Lead Exposure Elimination. Moving forward, I'm going to reference this initiative as the LFC initiative. So let's get started. So what is this initiative? Why did you all want to join? Why did I say I want to present this to you all today? Well, this is a national initiative to eliminate lead exposure and its associated negative health effects in communities across the United States. The LFC initiative offers a unique, comprehensive, multi-sector approach for encouraging and supporting communities to collaboratively develop and implement a customized plan to become lead-free. After this presentation, I hope you will have a strong understanding of the goals and purpose of LFC, awareness of the newly launched LFC Toolkit, which is fresh off the presses. We released it last Thursday, so it is on our website, as well as awareness on how you can work more with me and with the initiative and get more involved in preventing lead exposures in your community. So what is this initiative? I'll share more about the purpose and the goals of LFC, but usually when I get to this point in the presentation, I get a lot of weird looks. And so there's a pink elephant in the room. When I talk about lead-free communities, people start to wonder, what is she talking about? If you have an idea or if you have that question in your mind right now, please put it in the chat. Let me know if you're confused about something that I've said so far. And if you're wondering what I'm talking about, I'll get right into it. Many times when I talk about lead-free communities, people ask the question, well, Quanza, how is that even possible? Is it possible to actually have a community that is lead-free? Well, we do understand that lead is a widespread, naturally occurring element that cannot be completely eliminated. So yes, we understand that lead is everywhere and we can't just completely get rid of lead. However, the goal of this initiative is to eliminate exposure to lead hazards, primarily to children who are at high risk of negative health effects. So we want to eliminate the exposure to lead. Although the United States has made progress in reducing exposure to lead hazards over the last several decades, these hazards persist, especially in communities that disproportionately suffer from environmental injustices. In response, the CDC launched the Lead-Free Communities Initiative to aid communities across the country to safely, equitably, and comprehensively move towards eliminating or removing lead exposure hazards, as well as preventing their associated negative health effects. The LFC initiative emphasizes health equity and environmental justice and seeks to ensure all parts of the community have the support they need to become lead-free. By building capacity locally, the LFC initiative will help communities strengthen local ties and lay the groundwork for collaboration to address other issues that affect local health as well as their well-being. This initiative provides us with tools and support to make meaningful progress on the road to eventually becoming lead-free. We offer strategies to build a comprehensive and multi-sectoral, locally driven movement, as well as we hope to provide advancement toward environmental justice and health equity. The next few slides will highlight how we plan to accomplish that goal. We have a focus on primary prevention, preventing lead exposure before it occurs, because we hope to strive to, number one, eliminate major sources of lead exposure in a child's environment. We want to target intervention efforts where children live, play, and learn in a particular community, as well as we hope to leverage current ongoing efforts in a given community with new initiatives to create a comprehensive approach. So now I'm going to talk about the network. So I mentioned the initiative. The Lead-Free Communities Initiative is a broad umbrella, and underneath that initiative, we have several resources that we hope to provide to communities and organizations to work towards lead exposure prevention. I am so proud and so happy to say that we launched the LFC network in July of 2024 in Louisville, Kentucky. This network is a national learning and support network of communities working on lead elimination that support local progress and capacity building by sharing information, coordinating technical assistance, facilitating a peer-to-peer mentoring, as well as other learning opportunities. And we want to create a forum through which to encourage collaboration among individuals, communities, and organizations. This network is a mechanism through which to build interest in and support for eliminating lead exposure hazards. Current network members include communities that completed the Public Health Institute's National Leadership Academy for the Public Health. I also call it the NLAF program. And I would like to ask one of my colleagues to please place the website for NLAF in our chat box where you can learn more about this leadership program. It is a year-long applied leadership development program that supports multi-sector teams from across the country advance their leadership skills as well as achieve health equity within their community. So I hope I have sold you on the LFC network, but you may be asking, well, Quanza, if I join this network, what's going to happen? Does this mean you're going to spam my email box and send me a bunch of emails every week? And the answer to that question is yes, I am. So not too many emails, but I will send you important key updates related to the initiative as well as the network. So here are some things that I hope I will provide to you if you decide that the network is something you would like to participate in. Well, first, we just talked about sharing resources. So we do have a newly launched website that was added to the CDC website on last Thursday that is also fresh and hot off the presses. And I'll ask my colleague to please also place that link in the chat so you can peruse our new website. In addition to that, we're hoping to launch a webinar series later this calendar year where we will present on topics that are of interest to our communities. So for example, if you are a community, if you are a community-based organization and you are struggling with community engagement, so you want to do something around lead exposure, however, you're not quite sure what partners to bring to the table. How do we get the community members involved? Maybe we will have a webinar series on that particular topic. It is my hope that we'll create a series that will help strengthen your capacity and build your capacity to do the work that you are interested in doing. I mentioned that we launched the network in July of this year, that the network was launched at our annual LFC Summit. That was our first summit. It was a great meeting. We are hoping to have that every year. Right now, we are looking at July of next year for our next summit. The plan is for it to be here in Atlanta at CDC. We are also currently pilot testing or planning to pilot test a peer-to-peer mentoring program. So what does that look like? So if you are a new organization or you're an organization and you're new to lead poisoning or you're trying to launch a new activity or intervention around lead exposures and you're not quite sure what to do. Sure, you have Quanza. Sure, you have some connects in the public health field where you can ask some questions, but maybe you need a little bit more hand-holding in this part of your planning. Through the network, I'm hoping to build a system where we can connect you with another organization so that you can build a peer-to-peer mentoring relationship. So this will be something that maybe it would be 3 months, maybe it will be 6 months, but this will be a formal relationship in which a more seasoned organization can help you to grow and build your capacity in a particular area. In addition to that, we're also going to be pilot testing a technical assistance program. So you may say to yourself, well, Quanza, I'm currently working in this area. However, I just don't know about resources regarding lead and soil. We have these playgrounds. I want to do something about it. I want to get the soil tested, but I'm not quite sure what steps I should take. Then maybe you just need the network to connect you with a subject matter expert in the area. So we are going to pilot test the technical assistance. So how do you request official technical assistance through the LFC network? As of September of 2024, there are 67 individuals, 14 states and territories, and 18 teams participating in the LFC network. The teams include Louisville, Kentucky, Washington, D.C., Madison County, Missouri, Baltimore, Maryland, Philadelphia, Pennsylvania, Puerto Rico, Marion County, Indiana, Tucson, Arizona, Chicago, Illinois, Toledo, Ohio, Lansing, Illinois, Pittsburgh, Pennsylvania, Providence, Rhode Island, Macon, Mississippi, Salem, Missouri, Anniston, Alabama, as well as Rochester, New York. So as I mentioned, under the LFC, we've created many tools and resources to help communities to become lead-free. I've already talked to you about the network and some of the activities we have planned for the network. Next, I want to talk about the toolkits that I mentioned. So it should be in the chat, but the toolkit is something that we have been working on for a couple of years now. It is now on our website. And this toolkit is a comprehensive tool to support community action. It will help you build your capacity in certain areas, as well as it maintains a curated library of resources and information about lead hazard elimination strategies and practices. The next slides will take a deeper dive into this toolkit. And again, it should be in your chat, so if you want to open it and take a gander as I'm talking through it, please feel free to do so. This toolkit is a resource to support communities of all sizes and varieties in developing a collaborative plan to systematically identify and eliminate lead exposure hazards. It is a roadmap for community mobilization, which local leaders are encouraged to adapt to address their context and needs. And it's so important for me to stop here and talk about who this toolkit is for. So if you are an organization where you have been working in lead for 10 years, and you may say to me, well, Quanza, I know what I'm doing. You may know more about lead in your community than Quanza could ever know. You can still use this toolkit. This toolkit is still for you if there are some areas in which you want to build capacity, you want to expand your partnership network, you want to find more creative ways to finance your program. This toolkit is for you. On the opposite end of the spectrum, if you are an organization who has never done this work, so I'm contemplating doing something in lead, but I'm not quite sure. I'm not sure how to get started. This toolkit is pretty big. I think it's over 200 pages. Like, this is kind of overwhelming. I don't know if this type of work is for me. Well, I'm here to say that yes, this is also for you. So it's for the seasoned organization as well as for the novice in doing this work. This toolkit can provide you with excellent resources as well as guidance. Features of the toolkit include concrete steps and interventions communities can take as they work to become lead-free, tips for establishing a local network of partners to collaborate on lead hazard elimination, steps for developing and implementing a local action plan, as well as tools to engage the broader community in planning and implementation. Excuse me. The next slides will break down the table of contents of the toolkit. So one section is lead exposure and health risk. This section will provide information about health risks and common sources of lead exposure, such as lead-based paint, contaminated drinking water, contaminated soil. It provides information on environmental justice issues, as well as data on disparities. It also provides us with strategies to bring health equity to the forefront of our interventions. This section on building a local LFC movement provides details on guidance on how communities can build a local movement by organizing public health leaders, community members, as well as others to take action. It provides tips on forming a local LFC team to lead the development and implementation of a local LFC action plan, as well as tips for recruiting your network of local partners. This section also gives you guidance on how do you articulate what success looks like. So if you're an organization like, yes, Quanza, I'm going to do this. This is my goal. I want to work on lead in drinking water. Well, what is your goal? What do you want to see at the end of 6 months, at the end of the year? What does success look like to you? It also talks about how we can build community commitment, how to engage the community, how do we bring the right people to the table. It also provides tips on mapping your partner network. So we may have our certain partners that we currently work with, but are there other partners that we're not touching, that are not coming to the table, that we need to consider? The next section is developing a local LFC action plan. And I always tell people, I think this is the most important piece or part of the toolkit. Um, this plan provides a step-by-step guide to developing a local LFC action plan, which includes guidance on identifying key partners, outlining community engagement strategies, understanding lead hazards and potential interventions, developing criteria for prioritizing resources, as well as assessing your progress. It gives you a template for developing an action plan, as well as a template for creating your budget. And so I'm going to stop here and ask you all to put something in the chat again. If you did not have this presentation today, if you did not hear my voice today, but you said, hey, I want to do something, I need to start something related to lead, preventing lead exposure in my community, how would you start? Would you know the steps to take? You know, I think I would know. I think I would say, well, first I need to figure out somebody who can help me. So maybe I would sit down and call a couple of partner organizations. Not sure what I would ask them for. You know, I guess I could kind of feel my way through. However, with this toolkit, with this action plan, you don't have to feel your way through. We have provided you with the templates to ask you the right questions, to give you guidance on, hey, did you think about this? Did you think about that? Components of the local action plan gives an overview of your team operations. What skill sets do you currently have? What skill sets are missing on your team? A description of your community engagement strategies. Who do you want to bring to the table? How do you get the community involved? A summary of local lead hazards. So again, I mentioned, we talked about lead in paint, lead in water, as well as what area should you prioritize? Is it across your county? Is it a particular neighborhood, a particular zip code? It helps you think through those thoughts. Steps to address local lead hazards, as well as a plan to budget your finances, as well as how are we going to monitor and report what we're doing. Which leads us into the next section on monitoring and reporting progress. This section provides guidance on how communities can monitor progress toward their goal, as well as guidance on how to keep the broader community updated on progress. And so it talks about, hey, progress, what are we doing? Are we accomplishing our milestones throughout our intervention? Do we have a baseline? Do we realize where we started and where we want to go? Are we going past our baseline? It also helps you understand your successes. So obviously, hey, Quanza, you know, I want to remove this soil that has lead in it at this particular program. That is your ultimate goal. That's going to be the biggest success of your intervention. However, throughout your planning, throughout your process, you have several successes that you can document along the way. I did see a note from America Samoa in the chat, and one of their challenges was getting leadership buy-in. So the question is, well, why should we focus on lead when we have so many other areas to focus on? You can't taste lead, you can't see lead, and in many cases, you don't see the destruction that lead can do to a child until many years after the child has been exposed. So why should this be a priority? So now this person has to engage their leadership and figure out ways, how do I get that leadership buy-in? But however, once they get the buy-in from their leadership, that is a major success. So we encourage you to document your successes along the way, as well as document your challenges. So if you say, well, Quanza, I did all this work, nothing happened, I didn't have any challenges, it was wonderful, it was a success, I would be very disappointed. Obviously, I'm glad we're doing the work, we're accomplishing our goals, but I want to hear about those challenges, because there are other communities that are facing the same challenges that you face that can learn from what you're doing. So you always want to document your challenges, as well as document how you were able to overcome those challenges. And maybe you're not able to overcome them. It's like, hey, I really tried, but this is just a hurdle that we couldn't cross. Document that, because it's just good information for others to understand. Also, as you're moving forward in your planning, you may have to change something. So you may say, well, Kwanzaa, I thought this playground is where I wanted to focus. However, I didn't realize this other zip code had other major issues. And because of finances, I decided to refocus the plan to this other community. That's okay. That's normal. We have to do what we can with the resources that we have. But it's just really good that we document that so we're monitoring and reporting what we're doing. And then other communities can come to you and say, hey, can you help me? Do you remember I discussed we're going to pilot test a mentorship program? You may be one of the communities that I can connect with the newer community to say, hey, this person, this organization wants to do the same thing that you've done. And now you have a roadmap to show them, well, this is what we did. These are our challenges. So a few minutes ago, I said that the action plan template was probably my favorite and the most important part of the toolkit. But really, I think it's this one. So this is the financing lead hazard remediation. So this is probably, I would say they're all in the top three. Okay. So obviously I can see her all day and say, yes, 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 community organizations, communities. I want you to do this work. I want you to be interested in preventing lead exposure. But I can talk about it. However, many times communities have challenges finding funding sources. We need money to do the work. This section will highlight various sources of funding for financing lead hazard remediation, such as federal resources, grants, and loans, as well as this section will share creative financing solutions. So for example, there was a community in DC in which there were lead in the water service lines, and they needed to be replaced. So the many times the landlord will do it. They can be required to do it, but sometimes the landlords won't, or sometimes we can't enforce it. Sometimes there are other challenges or barriers to getting those service lines replaced. In this particular community, they work with the water company to increase the water rates. So that increase of 0.1% allowed the water company to go into certain communities and replace those lead service lines. Now, that could be a concern because, hey, my water bill is already too expensive. I don't know if this community can afford to have an increase to solve this concern. And that is why, again, we go back to the community engagement piece. So having a community at the table to kind of help us walk through possible solutions is very important. And one last thing I'll say, since I've been working in the lead branch, I've realized that remediation is just very expensive. So things that I just never thought about, never knew. The toolkit talks about if we want to remediate lead-based paint, that could be $8 to $15 per square foot in a home. Full remediation of a home could be at least $10,000. And we talked about the lead service line replacement. Well, that could range from $1,200 to $12,000. So again, this work, if we're talking about remediation, if that's something that we're interested in doing, we do need some type of financial resources. And this toolkit, I think, will help us give us guidance on how to find those resources. So, okay, I said the first two sections were my favorite, but really, I think this one is it. Community education and engagement and outreach. This section offers a variety of approaches to engaging the community in developing an effective and equitable LFC action plan. It proposes key points in the planning process when community engagement can be helpful. It also offers strategies for communicating effectively with various audiences. When we're planning out our action plan, we may know exactly what we want to do. So Kwanzaa's at the table. I have a plan. I know what I want to do. However, I'm going to invite some partner organizations and some community members. And I have to be prepared that they may not agree with my ideas. So I want to go to the water company and say, we're going to increase our rates so that we can replace these service lines in this community. Well, having the community at the table, they can now voice their opinion. They can now say yay or nay, or why that does not work for them. And those would be things that maybe I would have never thought about. So again, this toolkit would give us guidance on how do we engage our community, what's the best way to do that. And later in the presentation, I will share a really great example of something the community is doing with their community champions. Identifying and eliminating primary sources of exposure. This section includes extensive guidance on identifying and eliminating primary sources of hazardous lead exposure, broken down by exposure source, including paint, water, soil, other sources of exposure such as food, consumer goods, cultural items, as well as workplace exposure. It also provides you with guidance on how to fully remove each hazard, as well as management strategies for when full removal is necessary or also when remediation is not feasible. We also provide additional resources on federal tools and resources that may be available from CDC, EPA, FDA, HUD, and others. We provide other resources and links for federal action plans, policies, lead regulations, national resource hubs, and more. So overall, we hope that this toolkit is very comprehensive for you. We hope that we can build your capacity in all parts of preventing lead exposure. So not only on the cost, not only on the damages that lead can do, not only on the importance of health equity, but also how do you find the financing? I'll tell you that I never knew that deer hunting could be a possible source of lead. And so if you live in a community where hunting is very important, I know we're moving into that season, that is something that may be a topic that you want to address in your community, educating the hunters, educating organizations that are involved in that hobby or in that area, educating them on the risk of lead. All right, there we go.
The slide is divided into two sections. On the left side, a solid blue vertical panel features the title in white text, LFC Toolkit Pilot Test Results. At the bottom of this panel, a simple line illustration of interconnected pipes appears in a lighter blue, symbolizing infrastructure or connectivity. On the right side, against a plain white background, black text reads, Pilot tested the toolkit with 3 communities, followed by a bulleted list of 3 locations: Washington, D.C., Louisville, KY, Madison County, MO. The slide has a clean, minimalistic design, emphasizing the text for clarity and focus.
So we have pilot tested the toolkit with 3 communities. They've all used them successfully. Washington, D.C. Used the toolkit and the action plan to develop a program on lead service lines. Louisville, Kentucky created a program on lead safe housing registry. And Madison County, Missouri, which is one of the largest mining districts in the country, used the toolkit to help them figure out, well, how do we talk to our community? So in Madison County, Missouri, where mining is a big deal, sure, most people, most communities, most families are working in that field. So they are being exposed to lead. And the last thing they want to hear is someone saying, don't do that. Just pointing my finger. I don't want to hear you or see you pointing your finger to me saying that I shouldn't work in this area or I should prevent exposure, because this is how I'm feeding my family. This is how I'm paying my bills. So Madison County utilized the toolkit, the action plan and concepts of the toolkit to say, well, how do we create the gentle messaging? How do we educate families without making them feel like they're doing something wrong? Respondents of the pilot test found that the toolkit was very useful. It provided a helpful framework around how to build local efforts. I already talked about the top 3 sections from Quanza's opinion. However, the pilot test agreed with me. So the top 3 sections that these communities valued was developing a local action plan, financial considerations, as well as guidance on community engagement, education, and outreach. So, as I mentioned, the initiative itself is an overarching umbrella in which we're providing you with a lot of different resources. We talked about the network that I hope you will be interested in joining. We talked about this wonderful toolkit that's still warm for being printed and added to our website. But now I want to talk to you about community stories. So, we are highlighting communities that are taking action using concepts that we have included within the toolkit. The community stories are featured on our website, and I think we posted the website for LFC to the chat box. So the community that I'm showing right now is a CDC funding recipient, Sonora Environmental Research Institute. I work with them very closely. They have built their roots as a promotor organization. And when I say promotor, I am referencing community health workers. They created a community champions program, which enlists community members to educate others about lead poisoning prevention. So they went to the community and said, hey, we need your help. We will give you a small stipend if you come and help us with this particular project. These community champions go door to door. And when people answer, they say, hey, here's who we are. We want to educate you and your family about lead poisoning, as well as we would love to assess your home for any lead exposure hazards. Now, I'll tell you this. You want to get the right people at the table. So if I was working for this organization, I'm not from the community. If I went door to door, they may not open the door for me. They may say, who is this crazy lady asking to come into my home? However, because they recognize these people as members of their community, they trust them. So those community champions come into the home, and in particular, they assess their kitchen cookware. And so this particular community, many of the residents have roots from Mexico, and they use these Mexican clay pots to cook their food. However, because of the paint or the glaze that has been used to create those pots, there may be exposures to lead from utilizing those with cooking your food. So the community champions will test the pots for them. They will say, hey, this pot has lead. We would like to replace this for free. And so that is what this organization is doing. They replace the pots for free, and then they safely discard of those pots. And just a funny story is that, they say, well, Quanza, we can put them in our trash can. However, these pots are beautiful. They're beautiful pots. And if people see them, on the side of the road waiting for the trash pickup, they may go into the trash can and take them out and take them home. I don't know if you've ever done this, but I walked past somebody's house and saw they were throwing something out. I probably shouldn't admit to that. And I said, oh, this looks great. They're throwing it out as trash. Let me ask them, can I take this? And so this small organization has decided, well, no, we will trash them on our own in our personal trash cans to make sure we're keeping the community safe and no one sees these beautiful pots, in our dumpster. So again, this is just a great example of community engagement, bringing the right people to the table that can do the work, as well as gain the trust of the community. So how do we get involved? I've been saying, hey, I want you to join the network. I want you to go to our website. I want you to download the toolkit, utilize the toolkit. And so what does that look like, Quanza? What do you want me to do? I'll tell you what to do. Go to our website, learn more about the Lead-Free Communities Initiative. There's a link there where you can email me questions, as well as let me know that you are interested in joining the network. You can also provide me with any feedback or questions that you may have on some of the tools and resources that I've chatted with you about. If you are a community and you're doing some really good work and you want to be highlighted on our website, please let me know. I want to tell your story and share your examples with others. This is my email address, as well as the thank you to my colleague Gabrielle, who just posted the unit's email in the chat. And thank you so much for your time today. I'm going to pass the virtual mic back over to Brooke. Thank you.
Thank you so much, Quanza. I'm so grateful for that great information. I was learning a lot over here. So it is now time for our question and answer portion, and we've gotten some great questions in the Q&A box. And so I'm just going to start right in with those. And if you do have more questions for the Q&A box, please note the Q&A box is at the bottom of your screen, and you can drop a question in there. And if time allows, we will try to address all our questions for today. So the first question that we had come into the box is, what is the definition of lead-free? Eradication, question mark. So I wanted to give you an opportunity to talk about that a little bit for the benefit of the whole group.
Thank you, Brooke. Great question. And that may have come from the question that I asked when I said, hey, what's the pink elephant in the room? So many times when I present on this topic of lead-free communities, people wonder, well, isn't lead ubiquitous? You can't have a lead-free community, and that is correct. The purpose and the goal of this initiative is to eliminate the exposure to lead. So that is our goal when we say lead-free community.
Perfect. Awesome. Thank you. The next question we had is, what type of community can join the LFC? Can it be a singular tribe, a whole state, a city, an agency? I wanted to let you expand on that a little bit.
Oh, that is such a great question. And I could talk for 30 minutes on that question. So it can be anyone. So if you are, I'll just say if you are a state jurisdiction and you want to be involved, please come on, because states have communities, you have local jurisdictions. So I do think your message, as well as our tools and resources, can be of great value to you. So any organization, anyone that is interested, I want you involved. I want to build this network. And I'll say too, I didn't mention this about the toolkit. So what does this mean for a small community? Does that mean, well, Quanza, do I take this toolkit and do I read it from the cover all the way through to the end to decide what I want to do? Or, hey, Quanza, I'm a state, I don't have time for this, or I'm a tribal organization, I'm too busy. You can utilize the toolkit to fit your needs. So if you are a local community-based organization, if you are a tribal organization, if you work in the Pacific, whatever, you can utilize this toolkit. You can piecemeal it. So if you say, well, I really only need information about the financing, you can go to the financing section to build your capacity in that area. I think it's a good read. We try to make it reader friendly. We put bright pictures in there. So sure, I sit and I read through it to see if there's some additional information that I want to add, but that's not necessary. So based on your needs, we think that this toolkit, as well as our other resources, can be of benefit to you.
Thank you, Quanza. And you did have a comment come into the chat in response to your prompt about how you would know, where to go, who to contact. And this responder, Shelby, said, the only way I would know where to start is because I'm currently in an MPH program, but the toolkit makes it easier. So that's great. Next question I had come in was, let me pull this up a little bit. Do the cities who participate in the LFC network have a contact person that we can connect with directly?
Yes, they do. And I'll say, I don't think that I included their contact information on our website. If you could please put your information in the chat, I will absolutely connect you with those, with that information.
Awesome. Thanks, Quanza. Next question we had, does the LFC also provide resources on non-housing items such as consumer products and common goods and cultural items?
Yes, we do. So we have an entire section on cultural items, food, lead sources in food, such as spices, juice, jewelry, makeup. So yes, there is a section on that. But what I'll say also is that the toolkit is not necessarily the place to go for a comprehensive review on lead and spices, or a comprehensive review on lead and makeup. However, we will give you the introduction, like, hey, this is an area that maybe you should consider or you should learn more about. So I'll say we'll whet your palate. We'll give you the information that you need. However, this is not a training resource on all types of sources of lead. But yes, those items, that information is included in the toolkit.
Awesome. Thank you. And then we had a question come in from Cynthia. If we join LFC, what is expected from us regarding reporting?
That's great. And so thank you for that question. Um, you are not required to report anything to Quanza to CDC. This is a resource to help you. I want you to build your program, build capacity in the area in which you need it. I may just say, hey, if you do great or if you have some questions, then please reach out. So I'm going to say I'm requiring you to call me and let me know if you need some help. That's the only requirement. But this toolkit, our resources are literally there just to help you build your capacity. As you join the network, that means, hey, you can now be involved in our webinar series. You can now share your story so we can create a community story to post on the CDC website and share with other organizations. Maybe in the future, you will be interested in getting participating in a technical assistance program. So we will ask that you come and seek technical assistance if you need it. Maybe you want to join the mentorship program. So there's nothing required of you. This is a tool for you to build your capacity.
That's awesome. Thank you. The next question I had is, will this toolkit be available in other languages?
That's a great question as well. So right now it's in English, and I'm just so proud that the English version is online. However, we do have plans to translate the toolkit in Spanish. So more to come on that. And as soon as we do, that, of course, the announcement will be made.
Okay, thank you so much. So that wraps up the questions that I see in the Q&A box. And so I think we are coming to the end of our Q&A session. Some great questions, and thank you for the wonderful responses, both Quanza and the lead team that's on. I appreciate your responses in the chat. And let's go to the next slide, please, Renee. Thank you. So thank you so much for joining us today. And as always, if you have any follow-up questions or any comments or anything specific to this presentation for Quanza, please either email Quanza, or if you didn't get her email down, please email us at ehnexus@cdc.gov. And any questions you have, we will be sure that they are forwarded on to her or the appropriate SME, depending on what your question is. We're grateful for the information today. We're grateful for Quanza's time. And we're so thankful that you joined us today and gave us an hour of your time to learn more. So thank you so much, and have a great rest of your afternoon. Bye, everybody.
Thank you, everyone.